words.
Senator. You not.
Senator Wright,
Yes,
you have
thank you.
questions, and you said you only had a few, is that
Yes,
correct?
I do, that's right. Again, on the preventive health, the National Partnership on Preventive Health, and I've been listening with interest. It's not an area that I have a lot of understanding about, so I want to just tease out a few more things. So particularly looking at those two programs that impinge on that were part of the state's ongoing, well, the agreement with the state's Healthy Workers and Healthy Children.
Yes, sir.
Yep. What reviews of those programs have taken place? Now, I understand there was the review that started some years ago about the actual nature of the process of the partnership itself, but what reviews of those particular programs have taken place?
There hasn't been a review undertaken of those particular programs as yet, Senator. States and territories are in the main responsible for reviewing the performance of their particular measures. We don't have that level of granularity of each of those programs in order to undertake, I suppose, a comprehensive evaluation. The funding was provided to the states and territories, and they were going to provide a summative evaluation that was going to be undertaken.
So I understood that answer earlier. You've been it a couple of times saying you didn't have that degree of granularity. So you don't necessarily not aware of all the different programs within those.
We have some I suppose some understanding of some of those programs, but across the board we were not provided with that level of detail by states and territories. They weren't required to provide that level of detail under the funding agreement.
But yet I'm hearing that there was a clear conclusion drawn that it wasn't an efficient use of money, and I'm interested to know how that view can be reached if there wasn't actually evidence on which to ascertain
as I said,
how
the formative
programs were
evaluation
operating.
that was undertaken demonstrated that, or showed that there was a degree of duplication across a number of jurisdictions undertaking very similar programs, printing very similar resources across school programs, across workplace programs and the like. And so that information I think was taken into account by the government in reaching their decision to terminate the program.
But in terms of outcomes, in terms of whether indeed even having slightly different but targeted materials across different programs may have indeed had good outcomes, that maybe that degree of finessing was actually effective. We don't know unless there's been an evaluation.
Well, states and territories were responsible for looking at some of those elements that would then be summed up into a more macro level evaluation of the initiative.
Yes, but it wasn't states and territories that made the decision to not continue to fund these programs. It was the Commonwealth, and one of the bases of that we've heard about.
As I said, Senator, we don't know at this point in time whether states and territories are going to discontinue those programs.
Just let the Commonwealth part of the funding, it was the Commonwealth that made the decision, the Commonwealth government that made the decision not to continue with their share of the funding, and one of the rationales for that is that it wasn't an efficient use of taxpayers' money, and the only basis on which I've heard that assertion is made, because there wasn't actually a review of the efficacy of these programs, was that there was some duplication. My point to you is that there may have been some duplication in terms of the example you've given is materials across different programs that looked similar. We don't know whether in fact that finessing to that extent may have been effective because of the actual outcomes the programs were delivering if the Commonwealth didn't have that evidence on which to base their...
Yeah.
And that wasn't there.
To comment
that wasn't
on that
there.
component.
Well, that was, but from what you're saying, that wasn't there. There haven't been evaluations of those programs that the Commonwealth has been privy to in making this decision. Is that right?
Not that I'm aware of, Senator.
All right, thank you for that.
Have you got any more questions,
Yes, I did.
Senator
I
Wright?
wanted to know what impact those preventive health programs had on hospital care. Is there any means by which that conclusion could be drawn as to the Healthy Workers program?
Again, we would have to rely on states and territories for the provision of any data to support that assertion. I'm not aware of any data that is held by the states and territories that could draw that correlation at this point in time, Senator.
And did the
Senator, can I
Yes.
point you to, there's an OECD paper on the economics of prevention, which I would actually commend to the committee. What it does is it actually evaluates the cost effectiveness of primary and secondary prevention, and it makes the point that actually it's quite hard to draw a long link. So I'm sure the Parliamentary Library could get it for you. I would commend it to you.
I appreciate that, and I understand it would be hard. What I'm interested in is to what extent there's been a methodical, meaningful attempt to actually find out how effective these programs have been before the decision was made to cease the Commonwealth share of the funding.
Well, the issue was that the benchmarks that were required to be met in order to attain performance, I suppose, and the goals that were set for the program, wasn't specific to reducing the incidence of people hitting hospitals, Senator. That was not part of the original design of the program.
No, it may well have been the case. I'm just interested in whether it would be possible to get any data on that, given that one of the arguments is that there's the sustainability of the healthcare system and so on.
The reality is it would be almost impossible to do that.
Right.
Senator
The
Wright,
last one just is modelling. Yeah,
question,
thank you, Chair. Has any modelling occurred with respect to the impact on future health budgets that would be effective because of removing these programs?
It would not be possible to model that, Senator.
So there's no predictions able to be made about the effect, about the costs of removing these programs. So we really didn't know what they were achieving in a sense, in terms of dollars savings on health.
That's why I'd commend that OECD paper.
I appreciate that it's difficult, but we really don't. It's a bit of a guess then. We just hope it works, that there's no way of ascertaining whether it will save money or not and how much money it might save to use preventive health care.
The reality is there are a bunch of convoluted economic mechanisms you might be able to use, but it's easier to go to things like, for example, the impact on health expenditure and productivity more broadly in terms of reducing smoking. So those kinds of equations are relatively easier to do, but to get into a broader suite of things is actually much more difficult.
Thank you.
Thanks, Senator Wright. Senator Moore.